When will it be possible to finally call COVID-19 an endemic disease? Hi there, it's Jeff, and this is Plain English lesson number 453. JR is the producer, and he has uploaded the full content of today's lesson to plainenglish.com/453. Coming up today, 2 years this pandemic has been going on, and it's possible to see how COVID-19 can become endemic, meaning that it follows a regular and predictable pattern. The English expression we'll talk about today is build up, and we have a song of the week. Let's dive in. The government of Great Britain recently released a plan called Living with COVID. Under the plan, all legal restrictions related to the pandemic have been lifted in England. Masks are not required in public places. Travelers are not required to test before returning home. Occupancy restrictions have been lifted, and contact tracing has been canceled. Even people who test positive are not legally required to self-isolate, though that is still recommended. In the U.S., most of the pandemic rulemaking is done at the city and state level, and many states are now starting to say that vaccination is no longer required to enter indoor establishments like bars, restaurants, and gyms. They're also removing indoor mask mandates. It's similar in Europe. Just months ago, Germany and Austria had been debating making vaccination mandatory for their whole populations. Today, they're lifting restrictions, though mask wearing is still expected to be required in many places. Just one thing. People are still getting COVID-19. But rich world governments, if not always their top doctors, are starting to treat COVID-19 like an endemic disease. But what does that look like? Diseases are either epidemic or endemic. When they're epidemic, they spread rapidly through a population. They can overwhelm hospitals and healthcare providers, and they can rapidly cause serious illness or death. An endemic disease can also cause serious illness and death, but it doesn't spread as rapidly, and it doesn't take the population by surprise. An endemic disease, though, can still be bad. AIDS, for example, was an epidemic disease for many years before effective treatments and prevention were developed. A disease moves from epidemic to being endemic when its spread slows and when people have the tools to reduce the severity. And that's about where we are with COVID-19. People have protection from vaccines or from natural immunity. In other words, they got it before and their bodies have built up some immunity. There are also better treatments available, which make getting COVID-19 much less dangerous than before. Each successive wave of the disease is less severe than prior waves, even if the number of cases is high. If COVID-19 follows an endemic pattern, there will be a range of potential case counts and deaths in any given year. The disease may also follow a seasonal pattern, where most people get infected during the winter, for example, and not every year will be exactly the same. Just like the flu, some seasons may be mild, while other years may be worse. But the incidence of the disease will be generally predictable within a range of potential outcomes. In the rich world, people who die of COVID-19 in the endemic phase will likely be the elderly, people with compromised immune systems, or those who refuse to be vaccinated. Unsurprisingly, regular COVID-19 vaccination will continue to be advised. Vaccine makers will study the variants present in the world and consistently adjust their formulas so that the vaccines target the variants spreading in a given season, much like how the influenza vaccine is developed each year. Moderna, for example, is already developing booster shots that target the Omicron variant that's currently in circulation. And new variants are always possible. Experts have predicted the end of the pandemic before, only for a new variant to sweep through the world. For that reason, we may see localized or temporary return of mask wearing, social distancing, working at home, temperature checks, and occupancy limits. Now, there is another sad characteristic of endemic diseases that COVID-19 will probably also share. Measles, cholera, and more recently, AIDS are all endemic diseases that affect poor countries far more than rich ones. Countries that don't have access to the latest vaccines or whose healthcare systems are not as developed, those countries will probably suffer more. As the experience with AIDS shows, ignorance by national leaders and the population can lead to needless suffering. Despite the changes in recent laws, endemicity is still in the future, but that future appears much less far off than at any point before. I don't know. I almost don't know what to believe anymore about the end of the pandemic. Just a few months ago, the U.S. had 800,000 new cases of COVID-19 per day, the most ever in the whole pandemic. And yes, it's down 90% now. But do you remember the panic in the air when you first heard the word Omicron variant? And then you heard that vaccines were not effective against it? Well, what if that happens again? Now, obviously, I'm not looking forward to a day where COVID still kills many, many people a year, but hopefully in a year or two, it will just be a disease like others that we have to live with on this planet. Today's English expression is build up. There are two ways to use build up, but we'll talk about just one of them today. When you build something up, you make yourself stronger. In today's lesson, you heard that diseases like COVID-19 move from being epidemic to being endemic as the population builds up immunity. The immunity can come from vaccination or from a prior infection. When should you exercise after getting COVID-19? First, if you exercise around other people, you should wait until after you test negative. But setting aside those considerations, is it healthy to jump right back into your exercise routine? Most doctors say that you should be careful about resuming an exercise routine right away. If you've gotten COVID-19, your body has been hard at work fighting a disease, even if you don't feel it in your muscles. For that reason, doctors say you should build up your strength for a few weeks. You should start with some light exercise like walking to get your lungs in good shape. Then do a lighter version of your routine, and then finally you can resume your normal routine. You need to build up your strength when rebounding from the disease. Have you ever run a long race? I've run 3 marathons, all many years ago. That phase is behind me, thank you very much. A marathon is 26.2 miles of running. It took me over 4 hours. I didn't just wake up one morning and run the race. I built up the stamina to run those races. That means for months beforehand, I was out doing training runs, gradually extending the number of miles I ran in a day and in a week. I had to build up my stamina. The same works for bike rides. I used to go on long bike rides too, sometimes 75 or even 100 miles at a time. The first ride of the season was not a 75-mile ride for me. I'd start with something like 25 or 40 miles and then gradually build up the strength in the season to do the longer rides. Athletes that get injured need to go to rehab. Let's say an athlete needs to get knee surgery. First, the injury has to heal. Then, the athlete has to build up strength in that knee. Imagine a basketball player misses months for knee surgery. His knee might be better in the sense that it works properly, but he also needs to build the strength back up before going into a game. A few weeks back, I told you about the SAT, the standardized test we all take to get into college. That's a 3-hour exam. Now, a lot of people just wake up on the morning of the test, walk into the testing room, and take it. But this is not the recommended strategy. It's a 3-hour test, timed, and it's hard. You really should build up to it by taking some practice tests beforehand so that you're used to the difficulty level and you're able to concentrate for such a long time. I've told you before that I've gone to India a few times for work, and everyone was very protective of me there. They didn't want me eating food that might make me sick. And I asked someone one time, I said, why do you think I'll get sick by eating something if you don't get sick? And here's the answer I got. Indian people all do get sick from that stuff. They just get sick at a young age, and they build up immunity over the years. And that way, an Indian person might be able to eat something questionable and be fine, whereas I'd get sick from it. Time for JR's Song of the Week. This is another case where I said, oh yeah, I remember that song. And then JR reminded me that he picked the new version, which of course I hadn't heard. Well, here it is, Tom's Diner, and I have no idea how to say the name of this band, but I think it's Annan May Concrete. I have no idea if I said that right, but I remembered the version of Suzanne Vega from the 1980s, the late 80s. I almost didn't recognize the new version, but sure enough, it is the same song, Tom's Diner, by, I think, Annan May Concrete. That is JR's Song of the Week. And that's all for Plain English today. Remember, you can find the full lesson online at plainenglish.com/453. That's where you'll find the fast version, the translations, video lesson, practice exercises, and much more. We'll be back on Monday with a brand new topic for you. See you then.